Hereditary retinal dystrophies, retinitis pigmentosa, primary pigmentary retinopathy. This is a group of hereditary disorders with diffuse photoreceptors and retinal pigment epithelium dysfunction, characterized by progressive visual field loss and abnormal electroretinograms. Classification: primary retinitis pigmentosa, local ocular disease. Secondary retinitis pigmentosa, single or multiple organ disease. Onset: early adulthood. Inheritance: autosomal dominant 10 to 20%, autosomal recessive 20%, X-linked 10 to 20%, and no family history in 40%. There is night blindness with late loss of central vision. Pathology: attenuation of retinal vessels, waxy pallor of optic disc, and peripheral bone spicule-like pigmentation. There is posterior subcapsular cataract. Macular lesions include retinal pigment epithelial atrophy, hypopigmentation with mottled fluorescence, cystoid macular edema with leakage from foveal capillaries, surface wrinkling, retinopathy with epiretinal membrane formation. Changes start at equator. Primary photoreceptor degeneration and atrophy involves outer retina, loss of photoreceptors, and outer nuclear layer. There is bone spicule pigmentation caused by intraretinal retinal pigment epithelium migration around blood vessels, intraretinal formation of new perivascular Bruch's membrane, macromelanosome. Retinal pigment epithelium is usually fairly well preserved. Extinguished electroretinogram with marked reduction of both broad and cone signals. Abnormal dark adaptation. Central inverse retinitis pigmentosa. Changes of retinitis pigmentosa confined to the posterior pole. It is autosomal recessive. Pathology: like retinitis pigmentosa with central or pericentral changes. Normal electroretinogram and dark adaptation. Other conditions with retinal degeneration: old ophthalmic artery occlusion, diffuse uveitis, infectious etiology as syphilis, paraneoplastic syndrome, retinal drug toxicity, and retained metallic intraocular or foreign body. Flecked retina syndrome, Stargardt's disease, fundus flavimaculatus. This is juvenile onset foveal dystrophy. It is the most common cause of central vision loss in adults less than 50 years. It is autosomal recessive, short arm of chromosome 1p21. Mutated ATP binding transporter protein expressed in rod's outer segments and not in cones. It could be autosomal dominant, chromosome 6, 13q34. Pathology: macula, Stargardt's, reduced visual acuity in early adulthood, 8 to 15 years, nonspecific mottling, Bose pattern, geographic atrophy, 50% of cases. Flecks: fundus flavimaculatus, perimacular peripheral yellow pisciform flecks at level of retinal pigment epithelium. Retinal pigment epithelium, PAS positive, cells contain abnormal lipofuscin, autofluorescence. Posterior retinal pigment epithelial cells massively enlarged, with eccentricity of nucleus with increased number of pigment granules. Normal ERG, abnormal EOG, RPE only involvement. Fluorescein angiography, silent or dark choroid, masked choroidal fluorescence by lipofuscin-like material deposition in retinal pigment epithelium, 80%. Vermilion fundus due to retinal pigment epithelial lipofuscin absorption, bullseye pattern, transmission defect, retinal pigment epithelial atrophy. Flecks are normal to hyperfluorescent, irregular, confluent, soft, and fuzzy. Fundus flavimaculatus without macular lesion lacks abnormal pigment. Normal ERG, abnormal EOG, retinal pigment epithelium only involvement. X-linked juvenile retinoschisis, a bilateral slowly progressive split in nerve fiber layer of the retina. It could be X-linked recessive, XP22, autosomal recessive with no macular involvement, or autosomal dominant with macular involvement. Pathology. Microscopic picture. Defect in motor cells function. Split in retinal layer is at level of nerve fiber and ganglion cell layers. Translucent, veil-like membrane projecting in vitreous with retinal vessels bridging over in infratemporal quadrant. Areas away from schisis show microcystoid degeneration at level of nerve fiber and ganglion cell layers. Foveal retinoschisis. Stellate maculopathy does not fill with fluorescein. Best's vitelliform macular dystrophy, a bilateral symmetric progressive retinal pigment epithelial dystrophy resulting in moderate loss of vision. It is autosomal dominant. 1% of macular degeneration. Onset, second decade of life. Gene is on long arm of chromosome 11q13. Pathogenesis. Dysfunction in the protein bestrophin localized to basolateral plasma membrane of retinal pigment epithelium and functions as a retinal pigment epithelial transmembrane choroid channel. Microscopic picture. Enlarged retinal pigment epithelial cells and increased amounts of abnormal lipofuscin accumulation related to abnormal ion influx. Choroidal neovascular membrane 20%. Normal ERG, abnormal EOG with severe loss of light response. Arden ratio less than 1.5. Macula shows an egg yolk lesion that scrambles and becomes pigmented with age, leaving a mottled geographic atrophy. Macula shows and fluorescein angiography shows a window defect and no leakage in the yellow deposits. Differential diagnosis of Best's vitelliform macular dystrophy. Adult macular vitelliform dystrophy. Pathology. Bilateral round yellowish ½ mm subfoveal lesions. Central pigmented spot. 4th to 6th decade is the affected age. There is good visual prognosis.